Hey everybody, happy Friday. This is Nurse Eunice with Florida Training Academy, and I have missed you. So I already see some people in the comments. So good morning, Louise. Good morning, Vivian. And as we do in every video, we will get started in about 10 seconds to give you time to receive your notifications. And we will get started shortly. Good morning. All right, so ready, set, review. Pass your CNA exam with Nurse Eunice and Florida Training Academy. Today we are covering, I think it's 70 live CNA practice questions. These are basic questions, so regardless of your level of knowledge, these should help you. Plus, we're going to give you the rationales. And good morning, Marlon. All right, everybody, let's get started. Question number one. What is the term for a device used to take the place of a missing body part? Is it A, pronation, B, abduction, C, external rotation, or D, prostheses? And this is easy. Let's see if you can reveal if you know the answer. And now reveal the correct response in 3 seconds. So 3, 2, and yes, Winifred, yes, Naomi, yes, Farad. It is D as in dog. You are correct. It is prostheses. A prosthesis is an artificial device that replaces a missing body part, such as a limb, hand, or eye. The device helps to restore function and appearance for individuals with amputations or congenital disabilities. So if you answered D, you are correct. Question number two. When a client has left-sided weakness, what part of a sweater is put on first? Is it A, both sleeves, B, the left sleeve, C, the client's choice, or D, the right sleeve? Linda, good luck on your test. You take it at 11? Oh, we're going to be praying for you. All right. So looks like Awana says B, Barad says B, Naomi and Kelly say B. So let's see if B is the correct response. And it is. So it's going to be the left sleeve. So when dressing a client with one-sided weakness, the affected weaker side should always be dressed first. This makes it easier to maneuver the clothing over the weak limb without causing discomfort or strain. And so many of you all are studying with us on a Friday morning, and I'm so happy to have you here. So, question three, it is appropriate for a nurse aide to share the information regarding a client's status with A, anyone the nurse aide sees fit, B, the client's family members, C, the client's roommate, or D, the staff on the next shift. All right. Think about confidentiality. Think about HIPAA. Who can you share information with? And Barad is like D. And Charles says D. Chrissy says D. Ray Ann says D. And you all are correct. It is the next shift. So confidentiality and proper communication are critical in healthcare. A nurse aide should only share information with authorized personnel. The family, we don't want our family always knowing our business. They are not authorized personnel. So in this case, you would just give the information to the next shift. Sharing details with family members, roommates, or others without proper consent violates the client's right to privacy and confidentiality under the HIPAA regulation. So you all knew that. Wonderful job. All right, our next question number 4. When helping a client who is recovering from a stroke to walk, the nurse aide should assist on A, the client's strong side, B, the client's weak side, C, from behind the client, or D, with a wheelchair. All right, so this person has weakness on one side due to their stroke. When you're helping to walk them, which side do you support? And everyone has it great. You have it right. You are such great caregivers. It is B. You're going to be on the client's weaker side. It's going to help stabilize the client and help compensate for the weakness. Question number 5. The Heimlich maneuver, also referred to as domino thrust, is used for a client who has A, bloody nose, B, a blocked airway, C, fallen out of bed, or D, impaired eyesight. All right. And so, even though you may know the answer on yourselves right now in the privacy of your home, I can't see you, but you can see me. I want you to demonstrate how to do those abdominal thrusts because this is what you would do if someone had a blocked airway. So the Heimlich maneuver is an emergency procedure used to clear a blocked airway in a conscious person who is choking. Remember, if someone's coughing, they're not choking. If they're coughing, you want to encourage them to cough. For most adults and older kids, they're going to universal choking sign. So if you see someone doing this, you'll ask, are you choking? They won't be able to speak. They won't be able to cough, but they should be able to hopefully nod yes. And then you will go behind them and do the abdominal thrust. But if the person's pregnant, take the knuckle of the thumb, go to the chest, and you would go straight in. So you go behind, go straight in. So that will be chest thrust because you cannot perform abdominal thrust or the Heimlich maneuver on someone who's pregnant. So next question, you all, question number 6. To best communicate with a client who is totally deaf, the nurse aide should A, smile frequently and speak loudly. B, smile often and talk rapidly. C, avoid eye contact. D, write everything out. Write out the information. How do you communicate with someone who is totally deaf? Kirsten says D. Zebonay says D. Albert says A. Let's see if we have any other responses. Ray Ann and Kateria, they all say D. So the correct response is D. Great job. So if someone is totally deaf, you can avoid miscommunication by allowing them to write out information, and you can also write the information. So writing information is the most effective way to communicate with someone who's totally deaf. It ensures clarity and avoids miscommunication. Smiling frequently is polite, but speaking loudly or rapidly is ineffective as the client cannot hear. Question 7. The nurse aide is asked by a confused client what day it is. The nurse aide should A, explain that memory loss is natural and the date is not important. B, ignore the request. C, point to the date on a calendar and say the date. D, provide the date and then test the client later. You have a confused client who is always asking what day it is. What day is it? Is it Monday? Is it Tuesday? And if you chose C, point to the date on a calendar and say the date, you are correct. Providing a clear and direct answer while pointing to the calendar helps orient the confused client in a supportive way. Question number 8. Oh, rapid fire. We're getting these done. I think before I said there were 70 questions, I think it's 60 on this test. So to avoid pulling a catheter when turning a male client, the catheter must be taped to the client's A, bed sheet, B, upper thigh, C, bed frame, or D, hip. Where do you tape the catheter? And now they have securing devices. So you can either use a securing device like a stat lock, or you can use tape. And where do you tape it? I see B's, I see C's. We're torn between B's and C's. Let's see which one I get the most responses of. We'll give 3 more opportunities. So in 5, 4, 3, 2, and it is not C, everybody. The correct response for this one is B. So when you're securing a catheter to the upper thigh, it ensures stability and reduces the risk of tension. So if you secure it to the bed, imagine how it's tugging. So we're not talking about the actual drainage bag. We're talking about the catheter that's going through the urethra. So you don't want to pull that too much because it can actually tear the tip of the penis, or it can cause an erosion. So if you tape it to the thigh, it helps with comfort. It helps with stability. If you tape it to the bed sheet or the frame, that is incorrect because the catheter can move with the patient, and you actually increase the risk of pulling it out. And of course, the hip is not the proper location because you'd be pulling it too far. So if everything needs to be draining dependently, so if the person's in the bed and it needs to be draining down to towards the feet. If you attach the catheter to the upper thigh, that means it's going to be secure. It won't pull, but it also allows it to drain downward. Okay, so they don't get the old urine back flowing, which can cause a UTI. So I hope that helped you to understand why B was the answer instead of C. Question 9. A nurse aide can assist clients with their spiritual needs by A, taking clients to the nurses aide's church, B, talking about the nurse aide's own spiritual beliefs, C, avoiding any religious discussions, or D, allowing clients to talk about their beliefs. You want to aid the client in their spiritual journey. How do you do that? Yes, Tanae, it is D. You're going to allow them to talk about their beliefs. Question number 10. A nurse aide must wear gloves when? So what this question is asking is which one is the most contaminating. So when would you wear gloves? A, when feeding the client. B, when providing peri-care or perineal care. C, when giving a back rub. Or D, when performing range of motion. When must you wear gloves? That is right. That is right. It is B as in boy. And I know you all want to wear gloves for everything, but you don't have to wear gloves for every skill. You wear gloves for skills that are contaminating. So gloves are essential when performing peri-care to prevent the spread of infection and maintain proper hygiene, as this task involves contact with bodily fluids. Gloves are not required for tasks like feeding, giving a back rub, or performing range of motion exercises unless there is a risk of exposure to bodily fluids. Or I would also like to add to that, if there's like broken skin, if there's broken skin on the back, if they have some cuts or some scratches, of course, you're going to be putting on gloves. And you wouldn't even be putting lotion on someone's back. If they had open areas, that would be something that you would defer to the nurse, because putting lotion into an irritated area could actually make that condition worsen. Question 11. When getting ready to dress a client, the nurse aide should A, get the first clothes the nurse aide can reach in the closet. B, use the clothes the client wore the day before. C, give the client a choice of what to wear. D, choose clothes that the nurse aide personally likes. I see some correct responses going. Yes, Michelle and Kelly. Let's see if we get a few more. Bibian, Rayanne, Charles, and Abigail. It is C. So for those of you all who are in the state of Florida, or if you're going to be taking your test with Prometric, there are so many companies that do the CNA exam test, but this skill will be performed on a mannequin. So dressing a resident would be a mannequin skill, but you still have to talk to the mannequin and give the mannequin two options. So there'll be two tops there, and you'd say, hey, do you want to wear this color top or that color top? Because we always want to include our residents in their care. So our rationale: providing clients with a choice about what to wear respects their autonomy, dignity, and preferences. And hold up, Erica, congratulations. I'm so proud of you. And I'm just so proud of you, because I do see you a lot and you are watching the videos. And I am so happy that we were able to help you on your journey. All right. So our next one, everybody, question 12. If the nurse aide discovers fire in the client's room, the first thing to do is A, call the charge nurse. B, try to put out the fire. C, open a window. Or D, remove the client. What is the first thing you do in a fire emergency? Hold up. I'm trying to keep up. Congratulations, Tanae. Hold up. I'm trying to get to it. They're moving so fast. There we go. I finally found it. So congratulations. I'm so proud of you all. What a way to end the year. You're ending the year with certifications, new credentials, and new opportunities. So for question number 12, if you chose D, remember, when there is a fire, we're always going to race, and the R stands for rescue. So the first thing you want to do is remove the client. So the priority in a fire emergency is the safety of your client. The nurse aide should first remove the client from danger, and you want to follow the RACE acronym. And some of that's cut off. So it is rescue, alert, or alarm. So if it's alarm, that means you're pulling a fire alarm, or alert, you may have to call 911 if you don't have a fire alarm in your nursing home, your assisted living facility. C, confine, close off those doors. And then E is exit. And if you can't exit, you need to use that fire extinguisher and extinguish the fire. So that is the RACE acronym. Y'all, I am so elated because you all have been my babies, and it is okay. Kelly, you passed your skills test and that written test. It is coming. Barad has passed his test too, and real nurse tears over here. I am so proud of you all. All right, question number 13. In order to communicate clearly with a client who has a hearing loss, the nurse aide should A, speak in a high-pitched tone of voice, B, stand behind the client when speaking, C, speak in a loud and slow manner, D, look directly at the client when speaking. Yes, Kirsten. So E means to extinguish or evacuate, because if the fire is really big and you can't evacuate, or if you have 50 patients and you can't evacuate everybody, you're not going to leave anyone to burn. So you're going to try to either evacuate or extinguish. All right. And so many people are putting in that they passed their exams. I'm sorry if I can't keep up with everybody, but D is the correct response. You're going to look directly at them when speaking, because they can usually read lips and observe facial expressions. Question 14. Which of the following stages of dying is usually the final stage? Is it anger, acceptance, bargaining, or depression? What is the final stage? And usually, whenever they reach the final stage, they consult an agency such as hospice. So, what is the final stage of dying? And Savi, Irene, Zebene, Vivian, you all have it. Once someone has accepted the fact that they have a terminal condition, acceptance is the final stage, and that is usually when hospice will be consulted. So I do want you to know that the stages are not always experienced linearly. Like, they're just not going to go through, oh, I'm in denial, and then I'm going to get angry, and then finally I'm going to accept it. It could go back and forth. So acceptance, however, still reflects a sense of resolution and calm. And again, that is when they usually go ahead and consult hospice, and we would start preparing for that person's end of life. And hospice is not sad. The care is amazing. You get nurses around the clock. You can have a CNA around the clock, especially in those final hours. And you get to be surrounded around your family, your friends, and your pets. So if you've never considered working end of life care or hospice care, I don't want you to be afraid of it, because someone who's accepted that they're going to die and they want to live out their final days the way they want to live is actually quite empowering. And so I did see a lot of comments in there. And for the person who said that they failed their written test, you are in the right place. Sometimes when you fail your written test, it's because of nerves. It's just too much going on. You have to take a clinical test, a written test. Sometimes you have to go back again, and that is okay. Now you're studying and you know what to improve upon, because they should have given you a report. And so just make sure you read their report so you know what areas to focus on. All right, so question number 15. If a client says, God is punishing me, or why me, how should the nurse aide respond? A, reply, God doesn't punish people. B, listen quietly. C, ignore the client. Or D, make jokes. And Erica's right, everybody. Congratulations to everyone who passed. And for those who haven't taken the exam yet, no worries. You got this time. You will pass it. Yes. Thank you for encouraging them, Erica. All right. So if you chose listen quietly, you are correct. When a client expresses distress or existential concerns, listening quietly allows them to share their feelings and feel supported. So as a nursing assistant, whenever we start talking about communication with your clients, and for a nurse too, most of the time it's us listening. We don't have to agree, but we have to be a listening ear. So whenever you're answering questions on your test that involve communication, just think, maybe I should be saying less and listening more so that I can really understand the needs of my clients. All right, question 16. The role of the ombudsman is to A, run a group of nursing homes, B, prepare classes that the nurse aides take to learn about client hygiene, C, control the nursing home budget, or D, work with the nursing home to protect clients' rights. What is the role of the ombudsman? All right, I see a lot of B's, but I am seeing way more D's than I am seeing B's, and you all are correct. So, an ombudsman is an advocate for your client. So, they ensure that their rights are protected and that their concerns are addressed. And they are independent of the nursing home administration. So, if a client has a problem with the nursing home, but they're complaining to the person they have a problem with, sometimes things don't get resolved. So, they would instead take their concerns to the ombudsman, who would advocate on behalf of that nursing home client. So, great job, team. Question 17. A nurse aide who is active in her church is assigned to care for a client who is not a member of any religious group. The nurse aide should A, help the client understand the nurse aide's faith, B, tell the client that it's important for the client to join some church, even if it's not the nurse aide's church. C, respect the client's beliefs and avoid starting religious discussions. D, arrange to have the nurse aide's clergyman visit the client. Well, that is intrusive. We want to be caring, we want to be concerned, but we do not want to be intrusive. So you all are correct. It is C. Respect is key. You're going to respect the client's beliefs and avoid starting religious discussions. And if no one else has told you, we don't discuss religions, we don't discuss politics. And if you don't want to start any envy or jealousy, you don't discuss finances either. So just some things, just keep hush, keep your opinions to yourself, and provide a great job taking care of your patients. Abigail, you need more questions and answers on medical assistant. We did create the slides for those videos, and I will make sure that whenever Phyllis comes back on Monday, I will have her do a CMA video for you. So thank you for reminding me about that. See, we're here to please. So Abigail's going to get her video next week. Question 18. The nurse aide notices that a client's mail has been delivered to the client's room. What should the nurse aide do? A, open the mail and leave it on the client's table. B, open the mail and read it to the client. C, read the mail to make sure it doesn't contain upsetting news. D, give the client the unopened mail and offer help as needed. Yeah, that was real easy. Going straight to the answer. The answer is D. Give the client the unopened mail and offer help as needed. That respects the resident's right to privacy and confidentiality. Kelly needs disease process. I didn't bring a pen with me, so I will try to remember that one. Question 19. Which of the following is a correct measurement of urinary output? Is it A, 40 ounces? Yes, Kirsten, it is illegal to open someone else's mail, even if they're a resident in your facility. So going back to this one, is it 40 ounces, 30 cc's, 2 cups, or 1 quart? How do we measure urinary output? Ooh, we got answers all around the board on this one. But the most dominant answer, it's been, all right, let me just show you. It is B. cc's is the correct response. So when you look at the other ones, we don't document urine in ounces. We don't document it in cups. We don't document it in quarts. When you think about ounces, quarts, and cups, that sounds like something you're drinking, right? We don't drink bodily fluids. So cc's is the correct response. And here it is. I'm going to show you the math. So, I think we have a math question later. So the correct measurement for urinary output is either in milliliters, small units of liquid. Our abbreviation for milliliters is mLs, or it's in cubic centimeters, which is cc's. As in 1 cc is the equivalent to 1 ml. So if you think of a medicine cup, a little small medicine cup, you have your Tylenol, it has the medicine cup. That medicine cup is usually either 15 cc's or 30 cc's. And since they are equivalent metrics, it's either 15 mLs or 30 mLs. But whenever you're taking your CNA certification examinations, you want to be careful because especially in the state of Florida, you cannot put mLs, even though it's the same exact measurement of liquid, you have to document in cc's. So that's the only tricky part. And I made sure I put it here in red. The state of Florida CNA exam requires urine to be documented in cc's, not mLs, not milliliters, but you research what is required in your state. Most hospitals don't care. Most hospitals, a cc, a ml, they don't care, but I need you to get your license so you can get into the hospital. So make sure for your state exam, you know how to document urine. cc's or mls, document it correctly. All right, so our next one is question number 20. The client offers the nurse aide a $20 bill as a Christmas gift, a thank you for all that the nurse aide has done. What should you do? Do you A, take the money so you don't offend the client? B, politely refuse the money? C, take the money and buy something for the floor? Or D, ask the nurse in charge what to do? What do you do, team? Yes, I know it's going to be hard because you know that you really want those $20 for a Christmas gift to make a nice cup of coffee, but you're going to have to politely refuse it because nurses' aides are not allowed to accept gifts or money from clients as it may create a conflict of interest or appear unprofessional. So you could refer that person to the charge nurse, and what they'd have to do instead is they would have to buy a $20 gift for the entire floor. So maybe they will order pizza that day. That way it's not showing favoritism to just one staff because we know that you are not the only staff member taking care of that client. Question 21. All of the following situations are examples of abuse or neglect except A, restraining a client according to a physician's order, B, leaving a client alone in a bathtub, C, threatening to withhold a client's meals, D, leaving a client in a wet and soiled bed. Which is not an example of abuse or neglect? Charles and Kirsten, you all have it. That is right, because we can restrain patients as long as we have a doctor's order. So the correct response would be A. Restraining a client may be acceptable if it's done according to physician's order and is for the safety or medical needs of the client. Question 22. If a client is sitting in a chair in his room masturbating, the nurse aide should A, report the incident to the other nurse aides, B, tell the client to stop, C, laugh and tell the client to go to the bathroom, or D, leave the client alone and provide privacy. Yes, your patients are going to be doing adult things. So what do you do when they're in the room doing adult things? Number one, if you would have knocked on the door, you probably wouldn't even have known that this patient was in there pleasuring themselves. But now that you walk in and they're pleasing themselves, what do? You walk out and you do D. You leave the client alone and provide some privacy. So masturbation is a private and natural activity, and the client's dignity should be respected. But knocking on that door will hopefully alleviate that. Now, sometimes you're going to have patients who are just disrespectful and they're just doing things and they're making you uncomfortable. That was not this question. That is something where if you're uncomfortable because you've knocked and they're still performing that act, you exit swiftly, and that's when you would get your nurse involved. All right, so question number 23. Medical math, yay! All right, so let's see. To convert 4 ounces of juice to milliliters, the nurse aide should multiply by what unit? Is it going to be by 5 mLs, 10 mLs, 15 mLs, or 30 mLs? So we're converting 4 ounces of juice to mLs. We multiply by what number? I'm doing my happy dance because you all have it right. It is D. Yes. So whenever we're doing our conversions from ounces to mLs, we multiply by 30. So for this one, if you're trying to get the answer, and for a lot of your CNA tests, they don't want you to do the full equation because they don't give you paper and pencil to actually do math on. But if you're going from ounces to mLs, you're always going to multiply by 30. So an equation would be for your test. They usually don't want to see 120 milliliters or mLs. If you can choose 4 by 30, you're going to be able to answer that question correctly. And again, that's for CNAs, not for your nursing students. Nursing students, you're going to have to give us the real numbers. All right, so question 24, in giving care according to a client's Bill of Rights, the nurse aide should A, provide privacy during the client's personal care. B, open the client's mail without permission. C, use the client's personal possessions for another client. Or D, prevent the client from complaining about care. If you find a way to perform D, please let every healthcare professional in the world know how you accomplish that, because patients are going to complain. All right, no one's perfect, not you and not the patient. So the Bill of Rights does A, provide privacy during the client's personal care. The Bill of Rights emphasizes dignity, privacy, and respect for personal boundaries. The nurse aide should ensure the client's privacy during personal care and never use the client's possessions without permission. Oh, the last sense a dying client will lose, is it A, smell, B, hearing, C, taste, or D, sight? What is the last sense that a dying client will lose? And in HER2, I want to take the medication aid. HER2, I thought about doing a test for medication aid the other day. What state are you in? Because I have to make sure I'm giving you the proper information, because I'm in the state of Florida. And so everybody in the state of Florida, if you've been a CNA for a year, you can take additional classes and become a certified medication aide. Medication aides do not work in hospitals. They usually work in assisted living facilities. It just depends on the state. So the reason why I need to know what state you're in, again, is because I don't want to be teaching you something or talking about something that wouldn't be applicable in your area. All right, so question 25, the last sense, of course, is B, hearing. So studies indicate that hearing is often the last sense to go in the dying process, even when other senses such as sight or touch diminish. So you have to be careful what you're saying to a client, what you're saying over them while you're providing care, because even though they may not be responding, they could possibly still hear you. And it would be nothing worse than for this person to wake up out of their coma, and if you had said something negative about them, for them to repeat that. Okay, so you want to be very mindful of what you say. And if you don't have anything good to say, don't say anything at all. Question 26, a client wakes up during the night and asks for something to eat. The nurse aide should A, check the client's diet before offering nourishment. B, tell the client nothing is available at night. C, explain that breakfast is coming in 3 hours. D, tell the client that eating is not allowed during the nighttime. The client woke up and they asked for something to eat. Yes, Chrissy. Yes, Ebony. Yes, Ray Ann. You can feed your patients at night as long as they have an order for you to do so. So you're going to be checking your orders. You all, the hospital food isn't that good. So maybe they didn't eat breakfast and then they kind of ate lunch and then dinner wasn't to their liking. So now it is 2:00 in the morning. You have a pantry that has sandwiches, peanut butter, cereal, and milk. Give the patient something to eat as long as it is actually allowed or permitted according to their orders. Question 27. The normal aging process is best described as the time when A, people become dependent and childlike, B, Alzheimer's disease begins, C, normal body functions and senses decline, or D, people are over 65 years of age. So what do we mean by the normal aging process? Let's see. Chrissy and Tanae and Vivian, I think you all have it. So no, Barad, is not when Alzheimer's begins. It is when those normal body functions begin to decline. Like right now, my sight isn't as good. And that is because I am aging. So the normal aging process refers to the gradual changes in the body functions and senses over time, including natural declines in vision, Hearing, strength, and mobility. When I see young people do this, they bend over and they be like, ugh, they grunt. And I'm like, oh my God, you're way too young to be making no sounds just because you bend over to tie your shoes. Who am I to judge? But I just want to make sure that you know that we're all aging and getting older. And just because someone has Alzheimer's, that alone isn't a sign of aging. We're all aging every day. All right, so question 28. If a client is confused, the nurse aide should A, ignore the client until he starts to make sense. B, restrain the client so that he doesn't hurt himself. C, keep the client away from other clients. D, help the client to recognize familiar things and people. And so I see Marie says that she's in Illinois, Kelly's in Missouri. All right. And so everyone has the correct response for this one. It is D. You're going to help them to recognize familiar things. Whenever clients confused, providing reassurance and helping them recognize familiar surroundings, people, or objects can help to reduce anxiety or confusion. And so there was this one nursing home or assisted living facility, but it was a long-term care facility. And they would require, before the clients were admitted, so they're called residents if they're in long-term care. Before the residents were admitted, they would have the family member bring a picture of their front door. And so what they did was for every one of the rooms within the assisted living facility, it looked like that actual resident's front door of their home. So that way when they're wandering around, they don't go accidentally into someone else's room because the door didn't resemble their door at home, if that makes sense to you. So it's just creative things that we can do. Maybe a certain color, a certain scarf that we can put in the room, so that they know which room is theirs, because we do want them to walk. They walk all the time. We don't want to restrain them. We just have to make sure they can walk around and be safe and that they're not going into another person's room. Question 29. What is the process of restoring a disabled client to the highest level of functioning possible? Is it responsibility, retention, rehabilitation, or reincarnation? We're restoring them to the highest level of functioning. So let's say someone broke their arm. The highest level of functioning would be for them to go through rehabilitation and be able to use their arm the way that they did before the injury occurred. So the correct response for this is C. You are right, Carlene and Marjorie and Rayanne and Shisha. I hope I pronounced that correctly. It is rehab. So the rehabilitation is the process of helping the client to recover to the highest possible level of physical, mental, and emotional functioning following illness or injury. Question 30, and we're going all the way to 60. So if you stayed this far, you all, I just need a few thumbs up. I need some likes. If you can go ahead and share it with a colleague or a friend, I'd appreciate it. One of your CNA buddies. Remember, that helps us in the algorithm, and that means that the computers, the systems will push our information, our videos out to others so that they too can pass their CNA tests with Nurse Eunice and Florida Training Academy. So question number 30. When changing an unsterile dressing, the nurse aide should wash hands. Hold up. Congratulations, Andre. I am so proud of you passing your test in New Jersey. All right. So I think that's like we're up to 5 now. 5 in one video who have passed their tests. So when changing an unsterile dressing, the nurse aide should wash wash your hands before the procedure, after the procedure, C, before and after the procedure, or D, before, after the removal of the soiled dressing, and after the procedure. Whew, that was a lot. But my baby Barad is the first one who answered it correctly. So yes, I know that was a lot of steps, but if you wash your hands before you change a dressing and you remove the dirty dressing, you cannot use the same gloves or unclean hands to apply a new dressing because your hands are now contaminated with the previous dressing. So yes, you have to wash your hands before you start. You're going to wash your hands after you take off your gloves, because every time you take off your gloves, you wash your hands again. So you remove your gloves because you remove the dressing, wash your hands again, and then you apply a new a new dressing, and then you take off your gloves and wash your hands again. So yes, that was a lot of hand washing, but that's how we prevent our patients from becoming septic and or sick. Question 30. We just said that it was D. So proper hand washing is essential to prevent infection. The nurse aide should wash hands before the procedure to reduce the risk of contamination, after moving the soiled dressing to avoid spreading bacteria, and after completing the procedure to ensure cleanliness. So I know that was 3 times you washed your hands during one skill with one patient, but pass the test, number 1, and then number 2, prevent your patients from becoming infected by providing proper hand hygiene and, of course, the use of gloves. Question 31. Clean bed linen placed in a client's room but not used should be A, returned to the linen closet, B, used for a client in the next room, C, taken to the nurse in charge, D, put in the dirty linen container. So you brought in a whole bunch of linens in the morning, and that patient ended up being discharged. What do you do with the linen that was not utilized on that patient or for that patient? And I'll reveal the correct response in 3, 2, and yes, it's dirty. You have to put it away. You took it out of the clean supply area. So once clean linens have been brought into a client's room, they are considered contaminated, even if they have not been used. This is because they may have been exposed to pathogens in the environment. So to maintain infection control standards and prevent cross-contamination, these linens should be placed in a dirty linen container and laundered, washed before being used again. Question number 32. The nurse aide finds a conscious client. So that means that this client is responsive, but they are lying on the bathroom floor. What is the first thing that you do? A, help the client to a sitting position. B, call for assistance from the nurse in charge. C, offer the client a drink of water. D, check for signs of injury. A person who's conscious, they're responding, they're breathing, they're on the floor. What do you do? I see an A, I see B's, I see D's. Let's see what the most of you all are going to say. I see another D, I see an A. All right, so remember, you are a CNA, and for your test, there are always nurses around. So if the person's on the floor and you sit them up, well, if they are on the floor because of their blood pressure being low and you sit them up, well, that just means that they're going to pass out on you again. So don't sit them up. Don't just go checking for signs of injury, because that means you may have to turn somebody who could have a spinal injury. What you're going to do instead is B, call the nurse. Get the nurse in the room right away and stay with the resident to make sure they are breathing. So the first priority is to ensure the client's safety and summon help for the nurse in charge. So if you're in the client's room, there's a panic button. Don't press the slow button, the call bell, the handheld button. That's going to take forever. It's going to take 5 minutes before the secretary answers that one. You hit that panic button, or if you're in the bathroom, you pull the emergency cord. Or if you have none of that, you're going to scream help as loud as you can to get some help in the room. So calling for assistance ensures that appropriate medical evaluation and interventions can be performed immediately. While it's important to assess the client for injuries and avoid moving them unnecessarily, the nurse aide's primary responsibility is to alert a licensed nurse who can take over the situation. So you remain calm, you stay with the resident, and you let them know that the nurse will be there shortly. And then we as a team get them off the floor, we get them into the bed, and then your responsibility will be whatever the nurse tells you to do, which is normally going to be get a full set of vital signs. Question number 33. If a nurse aide finds a client who is sad and crying, the nurse aide should A, ask the client if something's wrong, B, tell the client to cheer up, C, tell the client to stop crying, D, call the client's family. Well, I hope if I'm crying, you would actually address me and don't tell me to cheer up, because maybe I can't cheer up. Maybe I have clinical depression. So I need for you to do A, ask me what is wrong. The nurse aide should approach the client with empathy and concern. Asking the client if something is wrong gives them the opportunity to express their feelings and concerns. Telling the client to stop crying or to cheer up dismisses their emotions, and calling the family should only be done if appropriate after understanding the situation. And normally, as a CNA, you would never be the one calling the family. The nurse would be doing that. And before I call the family, I would call the doctor because, again, maybe this person needs a psychiatric evaluation, some mental health counseling, because depression, grief, anxiety, all of those are real health conditions that need to be respected and treated. Question 34. Clients have the right to A, smoke in any area of the facility, B, have access to a telephone, C, go anywhere in the facility, D, see other clients' medical reports. Now, I know none of you are going to answer any of these questions correctly because our residents do have rights, but there are limits to their rights. So they can't go anywhere they want, they can't smoke anywhere they want, and they surely cannot see someone else's medical record. So the correct response is, yeah, you can give them a phone though. It's going to be B. So clients have the right to access communication, including telephone, to contact the family, friends, and other support systems. Question 35. Proper use of a waist restraint requires the nurse aide to. So back in the day, we had these restraints we put around patients' chest and their waist to kind of keep them in the bed or keep them in the wheelchair. We don't do that too much anymore. Yeah. So what do? A, release the restraint every 4 hours. B, tie the restraint to the side rail. C, watch for skin irritation. Or D, apply the restraint tightly so the client cannot move. And yes, Chrissy and Irene and Barad and Vivian, you all have it. We never attach anything to a side rail because a side rail, it can move, and now we're strangling our patient. So we're not going to do B. It is going to be C. We have to watch for skin irritation. The nurse aide must monitor skin irritation and ensure the restraint is not too tight or causing harm. Remember, try to always get 2 fingers between whatever this item is we have on the patient to make sure they have proper circulation. Restraint should never be tied to a side rail, as they should be used in a way that allows the client to move freely and safely within the limits of the restraint. Question 36 of our 60 questions, so stay with us to the end. To prevent the spread of infection, how should nurse aide handle the soiled linens removed from a client's bed? Do we want to shake them in the air? Do we want to place them in a neat pile right over there on the floor? Shoot, there we go. C, carry them close to our body. Or D, put them in the dirty linen container. You all better not be toting stuff close to your body. That means you're taking all those contaminants home with you. And when you hug your kids get a big dose of the 15 patients that you had today, including their MRSA and all the other respiratory infections that they could have had. So whenever you are managing dirty linens, you are going to do D. You're going to put them in a dirty linen container. This helps to prevent the spread of infection. Soiled linen should be placed directly, so not on the floor. You put them in a container. Shaking them can cause germs to be spread in the air. Place them on the floor can cause the germs to be on the floor. And of course, you're walking on that and you could be spreading that throughout the facility. So from the bed, from wherever it is, from the bathroom, directly to the linen basket or the linen container. Question 37. A client needs to be repositioned, but is heavy. All right. So, all right. Miss Gertrude is 600 pounds. You are not sure how you can move Miss Gertrude alone. What should you do? A, try to move her by yourself. B, ask the family members to help you do it. C, ask another nurse aide to help. D, go on to another task and just not move her because she's obese. What do you do, team? And everybody has it right. We are a team. You're going to ask for some help. Just because she's obese doesn't mean you're going to leave her in one position all day. So when a client is too heavy to be moved safely alone, the nurse aide should ask for assistance from another nurse aide. Attempting to move that client alone could cause injuries to you, but it's important to work safely and collaboratively to avoid harm to both you and that client. Don't forget, we also have Hoyer lifts. Sometimes the Hoyer lifts have weight restrictions, but your facilities will teach you how to use the Hoyer lifts and also what the weight restrictions are for those particular lifts. Usually your patients who are morbidly obese, they will be on a special unit. So they may be on the bariatric unit, and the bariatric unit has larger beds, and they also have equipment, wider wheelchairs that are special for that population of patients. Question 38. To prevent dehydration of a client, the nurse aide should A, give the client frequent baths. B, wake the client hourly during the night to offer fluids. Let me tell you, if you did that to me, I would be so ticked. Don't wake me up to give me fluids. C, offer fluids frequently while the client is awake. D, feed the client salty food to increase thirst. Yes, Isata, Vivian, Irene, it is C. We're going to encourage fluids while the client is awake to prevent dehydration. Do not wake them up or give them salty foods, because salty food is just going to dehydrate them more. Question number 39. When transferring a client, most of the client's weight should be supported by the nurse aides. A, back. B, shoulders. C, legs. Or D, wrist. You're going to be lifting a patient. Where do you want most of your support to come from? Everybody has it right. Yes, Floyd and Inionam. I apologize if I pronounced it incorrectly. Mrs. Love Child of God. It is C. You're going to use those big muscles in your legs. So the nurse aide should use their legs, not their back or their wrist, to support most of the client's weight during the transfer. Using the legs help to prevent back injury and also ensures safer lifting techniques. Question number 40. To be sure that a nurse aide's weight is measured accurately, the client should be weighed A, after a meal, B, by a different nurse aide, C, at the same time of day, D, after a good night's sleep. Accurately weighing your client. How do we achieve that goal? Yes, yes, yes again, yes again. And that's why so many of you all are passing your test, because you are like mini geniuses, our future nurses here. It is C, at the same time every day. So to ensure accuracy, you're going to weigh them at the same time in the morning, before they've eaten, before they've had their cup of water, their cup of coffee. Ideally, this should be done again very early in the morning. So usually night shift before they leave. At 6 a.m., they'll start doing those morning weights, because when you come in at 7 a.m., the trays are already arrived and there's so much other stuff to do. So weighing them at the same time each day helps to ensure accuracy. And also, if you can get them up and take them to the bathroom before you weigh them, that way we can make sure we're getting a good dry weight and that we don't have a night's worth of urine also being weighed. Question 41. How many tips does a quad cane base have? A1, B2, C3, D4. Quad cane. Revealing the response in 5, 4, 3, 2, and quad means 4. So a quad cane has 4 tips or prongs at its base, which provide greater stability and support for the client compared to a single tip cane. 42. Before taking an oral temperature of a client who has just finished a cold drink, the nurse aide should wait. Is it 1 to 2 minutes, 10 to 20 minutes, 45 to 55 minutes, or at least 1 hour? So I just had water and you come into my room and you have to take my temperature. How long do you wait? Yes, Merlene. Yes, Alan and Abigail and Tanae and Chrissy. Yeah, you have to wait about 10 to 20 minutes. So my recommendation would be, all right, Miss Eunice, I see that you are now drinking your water. What I'm going to do is I'm going to start cleaning up your room. And then what I'll do last is retake your vital signs. So I know you came into the room to do the vital signs, but you have to wait 10 minutes. So tidy up the room. If the person's drinking coffee, just let them know that when I leave the room, I'll reheat your coffee. Because if you try to take my coffee from me in the morning, I'm going to say, no, you can't take my temperature. So the job is to help your patient to help you. So clean up the room, tidy it up. That way you can watch them to make sure they don't go back and drink anything else. And then if it's a cup of coffee, go and reheat it. And when you come back, take that temperature and then give them their coffee. And then you're off to your next client. Question number 43. Which of the following methods is the correct way to remove a dirty isolation gown? Do you want to A, pull it over your head? B, let it drop to the floor and step out of it? C, roll it dirty side in and away from the body? Or D, pull it off by the sleeve and shake it out? If I ever see you shaking a dirty isolation gown, I don't know who I'm going to report you to, but I'm going to report you because that would be absolutely nasty. So it is C. You want to roll it away from you. The proper technique for removing a dirty isolation gown is to roll it inside out, keeping the dirty side contained, pulling it away from the body to prevent contamination. This minimizes the risk of spreading pathogens. The gown should never be shaken out or allowed to fall on the floor. That's right, Ren and Fred, you had it correct. Question 44. What is the best way for the nurse aide to promote client independence in bathing a client who has had a stroke? Is it A, give the client a complete bath only when the client requested? B, encourage the client to do as much as possible and assist as needed? C, leave the client alone and assume the client will do as much as she can? D, limit the client to washing her hands. We're all about promoting independence over here. Just because you had a stroke doesn't mean that you can't move. You have one particular, or maybe one side of your body that doesn't move as well as the other. So with the side of the body that can move, we are going to do B. We're going to encourage them to do as much as possible. So if they had a stroke on the left side with their right hand, they can still comb their hair, they can clean, they can feed themselves. So encourage them to do as much as they can, and then you help with the areas they can't reach. You would clean the other half of their body, maybe their butt, their feet, etc. But do include them in their care because we want to make them independent, and hopefully the goal is for them to return home. Question 45. A safety device used to assist a dependent client from a bed to a wheelchair is called A, a posy vest, B, hand roll, C, C, a transfer gate belt, or D, a footboard. So you're trying to help somebody dependent. That means they're totally dependent upon you from the bed to a chair. What device do you use? And then Miss Love, child of God, sometimes when you work in a hospital, you see too much. So for your CNA test, I want you to really think about this from a really basic standpoint, not from a hospital standpoint, because you do more as a tech in a hospital than what a CNA can do. So keep it really basic. What we tell our students here at Florida Training Academy is if you have past experience, we need you to throw it away. Because it's going to be hard for you to take this test when you're seeing all this stuff done in the facility. It's done really fast, but it's also not done according to textbook, according to standards. So just back it up. It's nice that you work in the hospital, but you got to read the book and go step by step. Because if you take your test and perform the skills the way that you saw another CNA do it in your facility, more than likely you're not going to do your skills correctly. So that would be my tidbit for those of you who already have past experience working in the hospitals. You got to throw that away, learn a new way, and then pass your test, and then you can get that hospital position. So everybody, for question 45, yes, the answer is C. It is a gate or a transfer belt. So a transfer belt is the best device to help safely move a dependent client from a bed to a wheelchair. It provides support and stability for both the client and the nurse aide, reducing the risk of injury during the transfer. Other options like a posy vest are for restraint, while a hand roll is for positioning and a footboard is used to keep the feet in place. Question 46. If a nurse aide wears a gown to care for a client in isolation, the nurse aide must A, wear the same gown to care for all of the other assigned clients, B, leave the gown untied, C, take the gown off before leaving the client's room, or D, take the gown off in the dirty utility room. What do you do if you have on an isolation gown? And then Alan in midwifery, I would be so proud of you. I'm proud of you now, but yes, I love that goal. Yes, we have our NCLEX exams also, Barat. So in 2025, I'm going heavy on NCLEX. For you all who don't know what NCLEX is, that would be the exam that nursing students need to pass in order to become a nurse. So there's the NCLEX PN, which is for your practical nurses, and the NCLEX RN for registered nurses. So yes, 2025, we're heavy on NCLEX, but for right now, we're going to focus on CNA. All right, so let's keep going, team. Question 46, the answer is C. You got to take it off before you leave the room, because that's just nasty to walk outside the room in your isolation gown. All eyes will be on you as we're all looking at, no, she didn't come out with that nasty gown on. So the nurse aide must remove the gown before leaving the client's room to prevent the spread of infection. Question 47, when making an occupied bed, the nurse aide should A, put the dirty sheets on the floor. We know that's not the answer. B, help the client to sit in a chair while the bed is being made. C, lower both side rails before changing the sheets. D, raise side rails on the unattended side. What do you do? This one's tricky. What do you do? What do you do? I think I've seen one correct answer so far. Okay, now I'm seeing some correct answers. That is right, you all. So, because C said rails with an S, C is not the correct response, because if you're making or changing an occupied bed, you don't lower both rails. You only lower the rail on the side you're working on. And then, of course, when you're done and you're leaving that side, before you leave it, you need to raise it back up. So the correct response is going to be D. Raise the side rail on the unattended side. That's the side you're not on. When making an occupied bed, the nurse aide should raise the side rail on the side that the bed is not attended to ensure the client's safety. This prevents the client from falling or rolling out of the bed while the nurse aide works on the opposite side. Okay, so great job. I'm happy you all got that correct. 48. The nurse aide is in the employee dining room, and a group of nurse aides are eating lunch together and begin discussing how rude a certain client was acting. The nurse aide should A, join in the conversation, B, suggest that this is not the place to discuss the client, C, be quiet and not say nothing or anything to the other nurse aides, D, return to the unit and tell the client what was said. Well, if you do D, you're just as messy as they are. So don't do D, but what should you do to protect your client? Yes, Sophia and Blessing, it is going to be B, suggest that this is not the place to discuss the client. Look, you won't be their friend, but if they're gossiping, they're probably not your friends anyway. They are unprofessional, and it is unethical for them to be discussing the client's behavior in a public setting, especially in a manner that could compromise their dignity. And we all know that we have these fancy cell phones, and so it could be a family member on the outside the door listening with a cell phone and recording a conversation. So be careful what you say, because it could come back to hurt you, and it could cause you to lose the CNA and or the nursing license that you're fighting so hard to obtain. Question number 49. The nurse aide enters a client's room and the client states that he has pain. What should the nurse aide do? A, report it to the charge nurse. B, tell the client to get out of bed for a while. C, tell the client that the pain will go away soon. Or D, ignore the client's statement. The client has pain. What do you do when someone has pain based on the options provided here? It wasn't an option to reposition. So, yes, Blessing and Beatrice and Irene, we're going to have to report it to the nurse. So, the nurse aide should always report the client's complaint of pain to the nurse in charge, as pain management is a critical part of client care. All right, so let's go to question number 50. We have 10 more to go, and I'm so proud of you. A client is upset and crying over the recent death of her husband. How should the nurse aide respond? A, tell her not to cry because it will make her feel sad. B, close the door and leave the client alone to cry. C, take the client to an activity to help her forget her husband. D, sit with the client and allow her to talk about her feelings. What would be the best response for a client who is experiencing grief, depression from the loss of her husband? Yes, Tanae and Blessing, Asata, Barad, Abigail, Kirsten, you all have it correct. It is D. We're going to listen. We're going to sit down, make eye level contact, hold her hand. I see that you're upset. Can you tell me about your husband? So the nurse aide should provide emotional support by sitting with the client, allowing her to express her feelings. Grieving is a natural process, and letting the client talk about her loss can be comforting and help her process her emotions. Question 51. Which temperature is considered the most accurate? So where would you be placing this thermometer? What route? Is it oral? Axillary. Everyone say axillary with me. Axillary, because you all like to say auxiliary, and auxiliary is a cord. It's like an extension. So axillary, groin or rectal. What is considered the most accurate route for a temperature? And everyone has it right. Yes, we're going inside. It's a core temperature. We're going in. So it's going to be D, rectal. A rectal temperature is considered the most accurate as it closely reflects the body's core temperature. While oral temperatures are common, they may be affected by various factors such as eating or smoking. The axillary and groin temperatures are typically less accurate due to their location and external influences. So, rectal is the most accurate, but oral is the most common. I don't know when research is going to catch up to current standards, because before the pandemic, oral was the most common route. But now, given the pandemic, the forehead scans, the thermal readers, those I'm sure are the most common worldwide. Question 52. What is a beginning sign of a pressure sore? Is it swelling, numbness, discoloration, or coolness? The beginning sign of a pressure sore. And we'll reveal this answer in 5 seconds. So 5, 4, 3, 2. A lot of answers are coming in, and 1. And if you chose C, discoloration, you are correct, because it's not redness, you all. There are a lot of people who are brown. They will not turn red. But if something on my skin is discolored, it doesn't look like the surrounding skin, that could be a sign of a pressure sore. So the earliest sign of a pressure sore is often discoloration, typically redness or darkening, indicating that blood flow to the area is restricted. This can be a sign that pressure is being applied for too long in one spot. Swelling, numbness, and cooling may appear later in the process or be related to other conditions such as peripheral vascular disease, but they are not the initial signs. Question 53. When assisting a client with denture care, the nurse aide observes that the upper plate is cracked. What should you do? A, clean the dentures and return them to the client's mouth. B, call the client's family. C, call the dentist and make an appointment. D, report the damage to the nurse in charge. And we all know that you all have way too much to do and that you all are not dentists. So I know that you're going to do D. You got to report it. You're going to let that nurse know, because dentures are expensive and we got to go through like the whole steps, investigate how did they break, what can we do to fix them. We may have to change this patient's diet because we can't put those broken dentures in their mouth. So they may have to be on a mechanical soft diet until we can get their dentures repaired. Yeah, so you all protect those dentures for us and for your patients. Question 54. A new client refuses to wear a clothing protector at lunch. What should you do as a nurse aide? A, tell the client that he must wear it. B, put the clothing protector on the client. C, report this to the nurse in charge. Or D, respect the client's wishes. Mr. Paul doesn't want to wear that bib. We're not supposed to call it a bib, but that's how he sees it. That's a bib. It's not a clothing protector. So what are you going to do? And Valu and Flossie and Irene and Blessing, you're correct. You're going to respect their wishes. So the nurse aide should respect the client's autonomy. That means that they get to make decisions regarding their own care and their preferences. If the client refuses to wear a clothing protector, their wishes should be honored unless it poses a safety concern. Question 55. The nurse aide can best show that he is listening to the client by A, changing the subject frequently, B, responding when appropriate, C, correcting the client's mistakes, or D, directing the conversation. How do you show someone you are listening? Yes, Rose and Carlene, we are going to do B. We're going to respond when appropriate. So, the best way to show that the nurse aide is listening is by responding appropriately to the client. This demonstrates engagement and understanding. All right, so Miss Paul, yes, I heard what you said. That's very interesting. Well, how did you feel when that happened? Remember, it's not us giving our opinions. We're just trying to encourage the conversation, ask them engaging questions, and then at the end, well, that was really interesting, Mrs. Paul. It was so great talking to you. Here's your call bill. Is there anything else I can do for you? Because I have to go check on my other patients, but I'll be back to check on you in an hour. Because we do have those chatty catties. They just want to chat all the time, but you still have to get your work done. So you're going to be listening, but you're going to figure out a way to get out those rooms faster, sooner rather than later. Question 56. The best time to prepare for a disaster is A, while evacuating the residents, B, during lunch, C, when everyone is safe in their beds, or D, before it happens. When do we prepare for a disaster? If you're in California, I hope you're safe. I know they had a natural disaster. It was an earthquake yesterday. I have friends in Ohio, up north. They're showing me how much snow is there. So I know there are some weather-related injuries up north also. So the best time to prepare for a disaster, that's right, Egbo, it is D. We prepare before it happens. And so that's why you're always going to see us doing drills. We're going to do fire drills. You have to learn CPR. We have to learn what to do if somebody comes in and they're armed, if they have a weapon, because we have to be proactive, because we don't want to be trying to figure it out in real time. If you practice it, it's going to be second nature. So you know how to handle a disaster, whether that's a man-made disaster or a natural disaster. Question 57. The nurse aide is caring for a client who is agitated. What should you do? Speak loudly so the client can hear the instructions. I said, get back in bed. B, ask to reassign the care of this client. C, talk in a slow, calm, reassuring manner. D, tell the client to be quiet. Well, two things you never want to tell people is to be quiet and to calm down, because that makes them do the opposite. So whenever someone gets really loud, I go lower. So whenever someone is agitated or frustrated, they're acting out, I need you to do C. Talk in a slow, calm, reassuring manner. So speaking loudly can cause them to become agitated, while telling the client to be quiet may make them feel dismissed or invalidated. So speak slowly, speak softer, and always have your back towards the door. So it's like if you need to, you can back out. That way, if you can't get them to de-escalate, at least you have a way to evacuate. So not all of the time will these efforts actually work, but you need to be able to try to calm your patients down while also protecting and being safe. All right, so question 58. The purpose for padding side rails on the client's bed is to A, use them as restraint, B, have a place to connect the call signal, C, protect the client from injury, D, keep the client warm. Why would we pad side rails? What condition does this client have if we have to put pads on the side rails? And now reveal the answer in 5, 4, 3, 2, and to neighbor Rod, Irene, Deanne, yes, Miss Love, child of God, you are correct. Usually, you're going to see an order for padded rails if the patient has a history of seizures. So we pad the rails to protect the client from injury, because if they have a seizure, they start thrashing around, they can actually injure their extremities. Question 59. Exercises that move each joint and muscle are called adduction, range of motion, abduction, or rotation. Exercises that move each muscle and joint are called, and I'll reveal the answer in 5, 4, 3, 2, and if you chose B, range of motion, you got it right. So range of motion exercises are designed to move each muscle and joint through its full potential range to maintain flexibility, prevent stiffness, and improve circulation. Question number 60. How can the nurse aide best help a client who is not accepting a loss? A, leave the client alone. B, convince the client to accept the loss. C, encourage the client to talk. Or D, discourage individual activity. The client is not accepting the loss. They just don't believe it. So that means that they're in denial right now. They're frustrated. Nothing that you can really say right now is going to help this situation. So what do? You listen and encourage them to talk. So encourage the client to talk about their feelings, provides emotional supports, and helps them to process their grief. And so Valu Kalisa Zita, I hope I pronounced that correctly. Khalees, we had so many people, Barad, Erica, with so many of you all, you did such a great job. My Kelly, my Kirsten, my Barbara. Don't miss out. Make sure you share our videos with your colleagues, your CNA buddies. If you haven't already done so, subscribe to our YouTube channel, and then I will be creating some more free resources. So for you all who have downloaded our CNA prep books, our medical terminology books, we appreciate you. We thank you. We have so many free quizzes on our website, fltraining.com. But my goal for the winter break is to add more free resources for you all so you can continue studying, because we appreciate you and you all are our future. So everybody, guess what? We did it. We did 60 questions in 60 minutes. So Sazada from New York, you are welcome. Alan, you're welcome. Rayanne and Sata, I appreciate you all. And I know we're going to be back on Monday. I want to say at 6 p.m. But it's probably going to be a video for medical assistants. I won't be back on this weekend with any CNA video. So I love you all. Be blessed, and congratulations to all of those who passed their test. And for those who will be passing this week, we just want to say blessings in advance, and I'll see you all in the next video. Bye.